Welcome to the Let's Feel Good podcast. I'm your host, Annie. After nearly a decade of asking, why don't I feel good? I ultimately discovered the answers through simple changes to my daily habits. I've spent years healing myself and investing in health and wellness companies tackling the chronic disease epidemic. Along the way, I realized something important. True health isn't built through cold plunges, IV drips, or $30 smoothies. It's the small, everyday choices that add up, shaping both how we feel today and our long-term health. Let's Feel Good is here to keep it simple, giving you practical tips and swaps that compound into a lifetime of vibrant health. Thanks for being here. Let's feel good together. Welcome back to the Let's Feel Good podcast. Today we're sitting down with Dr. Alexia, an MD who trained at Tufts and pivoted into the integrative medicine space after realizing the system that she was trained in was not helping the very clients that she wanted to serve, including herself. Today, we're going to dive into the root cause of why so many women feel tired, anxious, bloated, burnt out, and disconnected from themselves, and sharing tactical tips to feel better from the inside out. This is an episode that deeply resonates with me, and I know it will resonate with all of you today. I am so excited to have you here, Alexia. I would love to start by just learning more about your journey. You started as an MD, and you ended up, moving into the integrative functional medicine space. So would love a quick introduction and a little bit about that pivot.
Yeah, thank you for having me, Annie. I'm really excited. I started with a traditional background in training in traditional MD school at Tufts. And during my time there, realized that medicine was not what I thought it was. I thought that medicine was there to heal people and that's why we became doctors. And to an extent it is, but at the same time, there's a lot that we didn't learn in medical school. And I felt like I needed more. I was tired of the short appointments, the going from diagnosis to medications, but just repeating itself over and over again. And I felt like there was so much that we could do with lifestyle that we never got the chance to talk about with patients. So I pivoted to doing alternative certifications in integrative and functional medicine through the end of medical school and after, even some culinary medicine coaching as well. And then created my practice now to serve my clients at a root cause health level. So I'm really getting to those root causes of their symptoms, optimizing their health, and all through lifestyle, diet, exercise, sleep, stress management, and occasionally supplements if that's what they need. And finding what's really impacting their health, asking those questions of why, spending the time with them, listening to them, and making those changes for them.
Yeah, so important. I know this is a very big question, but what is missing from the traditional medical model? Like, why is it sick care, not healthcare?
Yeah, multiple answers to that. So sick care, first of all, it's because it's such a reactive model. We're waiting until people get sick and then prescribing them something to slap a Band-Aid on it, and essentially, more than really understanding the underlying root cause and then treating that. A proactive model would be somewhere where you're doing preventative measures, you're coming in for those tests in advance, doing things proactively for your lifestyle so that you don't get sick. But really what I think is missing from the traditional medical model is that integration. Medicine is super siloed in medical school, and even beyond, you're very much looking at every body system as its own. You learn every system separately. You don't learn how they're interconnected. So you go for a skin issue and you don't ever talk about your gut. You go for a mental health issue, you never talk about what you're eating, how you're sleeping, even how your nervous system is. It's really just, here's a medication to fix that. And then you're not ever talking about anything else underlying. And all the symptoms that you come to your doctor with seem separate, but we're not asking how are they connected, because probably they are.
Yeah, it's so true. I remember the kind of the thick of my healing journey. I had eczema, psoriasis, I had gut issues, I had hormone imbalances, I had anxiety, I had weight inflammatory issues. I went to an endocrinologist. Here's Synthroid for your thyroid. There's no connection between my hormones. She didn't want to look into that. My OBGYN just, take the birth control pill. There's no connection between your nervous system or your thyroid or adrenal fatigue. And same with my skin. I remember I was at my dermatologist at Mass General, one of the best hospitals in the world. And I was super frustrated because I had eczema, psoriasis, and dermatitis. And I was like, I feel like my dermatitis is related to my gut, which it definitely is. Eczema as well. It's usually linked to candida overgrowth. And I had psoriasis, which was an autoimmune disease. And I also had another autoimmune disease of my thyroid. And I was like, isn't this connected to my gut, to autoimmune? No, 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 no. It was crazy. And they didn't even talk about diet or gut microbiome health. It's just here's 3 different medications you can try to treat all of them. And I'm like, what are even the side effects of these? Are they healthy? Are they going to make it worse? I think it's so frustrating. But how do you start? One, I guess, functional medicine providers are harder to find. I mean, I'm happy to have you here today because now everyone will know where to find you if they want to work with you. But they're definitely not as mainstream. I think they're becoming more mainstream. More people are understanding what root cause healing is, what functional medicine is, how lifestyle can really impact your health. But we're so used to just going to our doctor when we don't feel good. How do you know when you need to go deeper? Like if you're dismissed at a normalization or a medication, how do we know, especially as women, when like, no, something really isn't right? And where do we go to seek help and answers?
It's hard. I think that a lot of people end up coming to me at a point where it's not too late, but it's been too long. It's years and years of them going to doctors, feeling dismissed, like you said, and then they come to me. Very seldom do I get someone who says, "Oh, I'm pretty much good. I just want to optimize my health." It's get a few people, and that's great. And then I feel like that's actually a great time to come because then you're preventing all the other things that could happen. But it's usually someone who says, "I've been struggling like this for years. I just don't feel good anymore." And I think it comes down to having these conversations, educating people, and really just the awareness of we should take the time to take care of ourselves. It's not selfish to do that. Women are often dismissed in healthcare, but in their day to day lives, they think to themselves, I'm fine. I don't need to take care of myself. And a lot of people end up coming to me and say, all right, now it's my time to take care of myself. And it's once they get to that realization that they do that. But I think as we have these conversations in functional medicine, all of this stuff comes up more in the mainstream media and everything else, just day to day, I think people will start realizing it.
Yeah. I know this is another really big question, but at a very high level for someone who maybe doesn't even know what functional medicine is, what
hmm
is your approach and how does it differ from the traditional medicine model?
Yeah. So I have a relatively good description that I like to say for people that, may not be how you would Google what's functional medicine, but it's asking why this is happening versus what is happening. Okay, fine, slap the medication on. I keep saying that because that's how, in a traditional system, you learn symptoms, diagnosis, medication, repeat. You're not really learning anything else beyond that. And you're not trained to do anything else beyond that. Functional medicine is asking, why is this happening? Let's go deeper. I call integrative medicine more of an umbrella. You can pull from different modalities like traditional Chinese medicine, Ayurveda, whatever it may be. Functional medicine is one of those modalities. And within that, that is doing a lot of lab testing, but at a root cause level, also doing a lot of investigative puzzle piecing type of work, putting it together of connecting the dots, connecting those different systems together rather than just here's your symptom and we're going to mask that one. It's why is the symptom happening? What's underlying it? And a lot of them have very similar underlying root causes. And then once you address that and those imbalances, all of those symptoms end up improving.
And a lot of those symptoms or the root cause issues are driven by lifestyle. Is that correct?
Yes,
Yeah.
100%. A lot of the root causes are very much related to our day-to-day life, and a lot of it is stress. And it's not that, oh, you just need to reduce your stress. It's you have to do a lot of things to manage that because our lifestyles are more stressful. We're not eating well, we're not sleeping well, we're not moving as much, and it causes stress on the body. Social media, light exposure, toxins in the environment, products we're using, all of that contributes, and it's a stressor on the body.
Right.
So really getting at all of those things can make a big difference.
What percentage of chronic disease diagnoses are rooted in lifestyle?
At least 80 to 90%, I would say. Sure, there's some genetics, there's other factors, but I would say most things are lifestyle. And it's not the person's fault, which is why I was saying a lot of those factors are external. It's things in our environment, it's the way we live, it's your job. Driving to your job is not your fault.
Totally.
You have to do all of these things. But I would say 80, 90% definitely is driven by all of those factors.
Unbelievable. Unbelievable. And when we change our lifestyle, this is my whole thing is like you feel better today. And then you
Mhm.
also set yourself up for, a
Yeah,
significant reduction in your chances of getting a chronic disease. What
definitely.
I find mind blowing, I was doing a podcast the other day and digging into some research beforehand to prepare. Obviously we have a chronic disease epidemic in our country. The data between people our age, like 20s, 30s, even teenagers, the increase in chronic disease prevalence in that demographic is increasing
Yeah.
and outcomes are getting worse. Like young
Mhm.
people are dying from chronic diseases, especially like colon cancer and the number of diabetes diagnoses, even at like 18
Mhm.
year olds, 20-year-olds. It's crazy. But the thing that is so puzzling is that health and wellness as like a market is exploding. Everybody's
Yeah.
having to be on these supplements, these powders, these $50 workout classes, Haley Bieber smoothie at Erewhon, like, it's crazy, and it's the same demographic that's spending all of this money on, like, the trendy health and
Yeah.
wellness things, but it's also the demographic that's getting sicker and sicker. We have, like, the worst fertility issues, we have increased cancer risk, increased
Mhm.
diabetes, very poor metabolic health, and it a lot of hormone imbalances and gut dysbiosis and gut issues. And it's really interesting because, like, I think, and this is a little bit off topic, but I think that there's been this commoditization of health and wellness where there's
Yeah.
this new class of healthy band-aids. So people are
True.
becoming more and more aware of health and wellness in the sense of like a metabolism gummy or like a collagen
Mhm.
elixir or like some
Yep.
overpriced fish oil. All of that is great and quote unquote healthy, but it doesn't do anything if you don't have a foundation. I think that the work that you're doing, helping people build a foundation, and then all that stuff is extra. But I just find that so puzzling because it's like we're still missing the point, which is like we need a foundation.
Exactly. I always talk about that the foundation is those things I mentioned: diet, exercise, stress management, sleep. Those things are foundational. You can't just go to a sauna, red light therapy, IV drips, and do nothing else underneath. Those are great, yes, as tools in your toolbox after you hit this point. People ask me about peptides, for example, and I'll say, well, if you're not doing the base level of things, I don't think you need to add anything else right now because we really need to focus on the foundations. Sure, that's another tool. All of those things are great, like you said. But if you don't have what's underlying and what's really going to move the needle 90% of the way for your health, that extra 10% isn't really going to do anything.
100%. 100%. You like pee out supplements if your
Yeah,
body's so inflamed they can't even absorb the nutrients. Yeah.
exactly.
It's crazy. One other thing that we've chatted about offline, which is so interesting, and I fall into this to the T, but you mentioned that so many of your clients are type A high performing women, and so often you are seeing the same symptoms and treating the same things and working on untangling the root cause of so
Hmm.
many commonalities between these women. Can you talk about this interconnection between, the personality traits
Yeah.
and then the common symptoms and issues that you see?
Yeah, I find that most of my clients, like you said, are type A women. A lot are in corporate jobs, a lot are very busy jobs. And they are perfectionists at work, they're perfectionists in their life. And so they want to be perfectionists with their health. And so when they come to me and they have all of these symptoms and I give them something that I recommend, they try to follow it perfectly. And that doesn't even help. They'll come to me later and they'll say, well, I tried to be perfect and it didn't work. And I have to get it into their head that that's not the point. It is not the point to be perfect in your health. That stress is detrimental. They have so much stress about trying to be perfect that that's what caused these symptoms in the first place. That amount of nervous system tension is what has led to things like gut dysbiosis and leaky gut and um, their cortisol being through the roof and all these other hormone dysregularities. And I have to tell them it's not the point of this is not to be perfect. It is to kind of soften and slow down and move through life with a little more ease. And yes, they can try their best with work and all the other things that I'm not involved in. But sometimes when I give them these recommendations for their health and they learn that by, in an 80-20 model, trying to be doing a lot of the right things, but not 100% of the time, it translates into their work and their home life. And then they ultimately feel like they actually are more productive. They're able to enjoy life more. They have more happiness, more joy. They have better relationships. And then all the other things follow. And they're also sleeping and eating better and moving more and all of that, but not with that rigid mindset that they came to me with. And that's when they truly heal. Once they break that down, that's when all that is able to happen.
I almost feel like there are 2 camps of people, and I think the ones that we're discussing is a
Yeah.
little bit niche, but it probably is a lot of
Yes.
our listeners and a lot of
Yeah.
the women that you work with and even our friends. But I feel like there are 2 camps of people. There are the ones that are eating a highly processed food, inflammatory
Hmm.
diet. Their house is full of super toxic candles and toxic cleaning products, and they're driving and walking maybe 2,000 steps a day, vaping, smoking, excess alcohol, carrying too much extra weight, has absolutely no clue about health and wellness.
Yeah.
And then those people are definitely don't feel good or are probably most certainly on the track to a chronic disease.
Yeah.
And then there's
If
this
not already.
yeah, if not already, exactly. And then there's this camp of people, which I see. I mean, I was exactly that person that you're describing. I think a lot of my friends are, maybe a small group of highly functioning, super type
Mhm.
A, smart driven women who are really
Yeah.
into health and wellness. And they're doing all the things right, but it's out of control and it's driven by
Yes.
fear. And it's what they're missing is, like, the emotional piece. Like, they have all the
Exactly.
logic, but they're getting caught up on, like, if I had a piece of sourdough toast, did I ruin my week? And I'm like, if we're thinking like that, then we've totally lost the plot. And the reason why you're not healing is that you're missing the emotional piece. You are not embodied at all. It's almost like you look at it as the group I just described, which is super inflammatory diet, not moving, just like
Mhm.
classically unhealthy. And then you look at this, woman that we're talking about who's super high functioning, type A, going to all the workout classes, walking 10,000 steps a day, eating super clean, but they're actually like super unhealthy in the emotional part of it. And I think that dysregulation can make you just as sick as the other camp if you don't look at it. But it's really interesting because in that flavor of person that
Yeah.
we just described, when you're not embodied and you're totally living in your head, you miss the opportunity to actually like align yourself and heal your body in the way that it wants to be healed. Like for me, for years, I was following rules in a playbook. Like I ate
Mhm.
healthier than I eat now, and I was sicker. I weighed 30 pounds
I'm
more.
Yep.
I had horrible hormone issues. I had a raging autoimmune disease. I had a million and one skin conditions. I didn't eat a carb. I ate 100% organic. I took supplements if it was for the afternoon on an empty stomach. It was like at exactly 4 p.m. I'd set a timer. Like I was like nailing health, but like health
Mhm.
isn't meant to be something that is one. It's meant to be something that is like lived in and felt and embodied.
Yep.
And as soon as I actually started working with a somatic therapist and I started doing more
Yep.
embodiment work and I realized that, holy shit, I have this disconnection. I'm so living in my mind, not my body.
Yeah.
And then I like moved into alignment in my health. Once I felt safe, my health totally and it unlocked and I've been great for years. It's crazy.
Wow, that's
Yeah.
amazing. Yeah, the safety point is a big point. A lot of women, especially younger ones who still have a cycle, I'll find that their hormones are just non-existent and they're over exercising, they're under eating, they don't feel safe in their body. Their body does not feel safe to produce hormones and to, not have all their body break down basically. But they're like, "Oh, I'm working out and I'm eating perfectly." And all of these things that they're doing, you said 10,000 steps a day, taking their supplements. But it's that rigidity and that overdoing that makes them not feel safe in their body and not embody what they should be. So once we work on that and that emotional piece and kind of taking a step back, they're able to, restore their hormones and get their cycle back because a lot of women don't have one or it's very irregular and they have all these emotional symptoms. But that's such a big component of it.
How do you work with patients or how do you work with women?
It's hard. Everyone's different. So it's not a one size fits all. Some people, their hormones are low and some are high. It's not ever the same picture. I get a lot of very similar ones, but a lot of it is very much the lifestyle of we're going to calm the nervous system, maybe cut back on your workouts, add in a little more food just to start. Because I can't throw them a million supplements and say, all right, here, this is going to fix your hormones, even though there are some herbs that can help different hormones if they're not doing those foundational things like slowing down, the supplements are going to only work for a certain amount of time and then they're still going to be, living the way they were. So a lot of it is continuing to meet with them and having those discussions and really getting them to work through whatever it is in their life because yes, everyone might have a similar root cause, but the conditions around it might be a little different. Their life situations are different. So it's really just making those small incremental steps and coming at things with a different angle. So it's not just focusing on the food or not just focusing on the stress. It's all together is what really makes those differences.
Right. Right. So it feels counterintuitive. Like I get it because I used to be in that exact position where I remember one functional medicine doctor I worked with actually like caught this. She was like, "This is why you're not healing. Is because you're so
Hmm.
obsessed with healing."
Yeah.
And it was so uncomfortable because she was like, "You need to eat more diversity." She was like,
Yes.
once a week, if you want a chocolate chip cookie from Levain's, like have half of one, like and
Mm-hmm.
enjoy it and savor it and like skip the workout if you need to sleep in. And I
Yeah.
was like, but I'm supposed to be healing. Like these are things that are technically not aligned with, a perfect state
Yeah.
of health. And it's like as soon as I let that stuff in, I actually did start to heal, but it's very uncomfortable. What are
Exactly.
like the like I don't know, if take one client, for example, like what are a few of the things that you tell them to start getting comfortable not being perfect? Like, are there
I have a
little things that we can practice?
Again, it's also hard too. Even if I'm telling them something, it's harder to do it, but having someone else tell you it does help. I have a couple clients that just sparked a thought. I even have one this week that I was meeting with who I had her on a little gut protocol because of some dysbiosis that we found. And it wasn't, I didn't say to her, you need to be perfect in your diet. You need to be perfect on this. She came to me and said, I can't, after a month, I can't do this anymore. I can't live like this. I can't eat like this. And I said, I never said you had to be perfect. I said every week you could have a meal of whatever you wanted. I just wanted you to decrease a little bit of this while we're currently working on the gut. It's only a short period of time. But even then, I would rather you not be stressed about this diet because that's way worse to me. It's way worse to me that you are so stressed that your gut is going to become more inflamed than if you ate a piece of produce that I said was not recommended at this time. Or if you go out to eat and you're not really sure what's in the lentil soup, it's okay. You can still eat it. And so having that conversation for about an hour, finally she said, okay, now I feel so much better about this, that I don't have to be perfect. And I think that it was just something that's been so ingrained in her for all aspects of her life. And I have another client who's the same thing, same protocol, said, oh, I feel like I can't be perfect when I go out to eat. And I said, I didn't say you had to be perfect. And I always remind them that whatever I tell them, I want that to take stress away from them, not add to
Mhm.
them. So I would rather them not listen to everything I'm saying, whatever fits into their lifestyle. You have to take it into the context of who are you enjoying your life with? Are you going out to eat with people? I don't want you to stop doing that just because we're working on something on the side, because that connection, that time with other people, that enjoyment of food, that happiness you get outweighs all of the other stuff we're working on. And that leads you towards healing more than anything else.
So
So,
what is the balance? Because as I said before, like we
yeah.
talked about these two camps. And we're talking about like the highly functioned perfectionist women right now, which
Yeah.
is probably a small, I mean, in the circles, in the East Coast and
Seems
in the
like a lot.
major cities,
Yeah.
it seems like there's a lot of them. But given like the population of
Yeah.
America, it's probably a smaller group of people. And then you have these people that just like literally eat fried processed food, drink soda, Diet Coke. Bad, bad, bad. So there's like, we know food is medicine. We know 90% of chronic disease is driven by lifestyle. We know that like we really are what we eat, what we breathe, what we
Mhm.
consume. Obviously, stress is an enormous piece. But as you're a woman trying to navigate feeling your best, what is the balance between treating food as medicine and getting your strength training in, getting in a hot yoga class, getting in your steps, reducing environmental toxins, limiting alcohol, obviously avoiding smoking and vaping, and also enjoying your life and also not having to be a perfectionist? Like, there's got to be a balance, because if we're like, we're going to be so unperfectionist, so we're going to have chocolate cake every night, then we're probably not going to feel great. So, how do you work on that balance?
It really is individual, but it is truly thinking about what do you prioritize too? Do you prioritize going out to eat with your friends? Okay, then maybe you at home eat a little more clean, organic, more plant-based, whatever it may be. Do you want to have your makeup that is from a specific brand? Okay, but maybe your hair care or your cleaning supplies are from somewhere else. So it's kind of like a give and take. You don't have to have everything perfect in every sector that we're talking about. It's kind of just picking your personal priorities. So that's why I wouldn't give a recommendation of everyone has to be perfect on this area and can be lax on this area. It's really what it works with you,
Yeah.
who you live with, your own lifestyle. And coming back with that mindset of I don't have to be perfect, and progress over perfection.
Mhm.
So maybe next year you work on a few more items, but right now for you, maybe you can't do all of that. I even, for example, had a client where I gave them a goal for how many servings of fruits and vegetables to eat, and he said that was unattainable. So we cut back on it.
Mhm.
And that's okay. It's still better than what he was doing before. So anything is better, those little incremental steps, and then maintaining that balance with enjoying your life and not over stressing on that is the best that anyone can do.
Yeah. That is a really good point, because it's also about like your cumulative toxic load, or your
Yeah,
what you're doing cumulatively to your body. So it's like, if you love a perfume, but maybe you can switch out your hair care. It's like, what is like
yeah,
one small thing? And then over time, you might
yeah,
notice that you prefer the cleaner options, or you're being more educated on what's actually in the foods that you're eating or the products that you're buying, and you truly
exactly,
want to start making shifts. But I do think it's
exactly.
like, and then it's really empowering. Like, if you're, I don't know, I used to go to Kava all the time, and like, I'm sure it's all drenched in seed oils and is not organic. And like, Sweet Green does not use seed oils. And when I was living in New York City, I was like, can, these places are right next to each other. Every day for lunch, if I'm choosing sweet green, I'm, reducing exposure to a lot of
Mhm.
inflammatory seed oils. It's a cleaner lunch. I feel better. And that's
Mhm.
like one kind of consistent thing that I'm doing. And then you just layer on from there. Maybe the dinners, you start picking the grass fed beef instead of the conventional meat, or
Mhm.
your sweet treat is like a healthier option you make at home. And then if you really want the other thing, it's more of once a month. I totally agree with you. But I also think that when you lead with fear, like this is at least in the case with me, is I was so scared of how bad I felt. I was like, am I ever going to feel unstuck? Am I ever
Yeah.
not going to have these like raging hormones and PMS and like debilitating pain and 70-day cycles and like, such inflammatory issues that like my rings would get stuck on my finger or my shoe size would change depending on the week. Like I
Yeah.
felt horrible and it was like a state of panic. And what I was trying to do is just like outsource my healing to rigidity and to structure. And I don't even know if I liked what I was eating or if I liked the workouts that I was doing. It was like out of obsession and fear. And once I
Yep.
was like, honestly, like, screw it, I'm done. Like, I'm trying something different. And I let my body guide me. I realized that like before I wasn't even eating when I was hungry. I was eating when I thought I should be eating. And then when you tap into like the embodiment piece and you let yourself guide you, at least I found that I can ask my body, what are you hungry? Are you hungry for a full meal, for a snack, for fruit, for a vegetable? And be like guided by that in that communication between like your brain dictating your decisions, but being
Mhm.
driven by the advice and guidance of your body, that will naturally keep you in a state of health because you're making these microscopic choices to walk or sleep or do this workout or that workout or eat this or eat that or say yes to this plan or no to this plan out of a constant, let's check with the body, let's check with the body.
Yep.
And then you're constantly aligning yourself and you stay healthy without rigidity, without fear, without counting calories, without a workout plan. And it's like that
Exactly.
is the state that you want to try and get into, but it is hard.
I was gonna say it needs to come from a place of compassion or alignment with your body rather than a state of fear. Same thing when it comes to what are you prioritizing and those choices you make. It has to come from a place of alignment with you and joy and compassion for yourself, and not a state of I'm picking this because I'm afraid. And it's hard, but once you get over that fear and trust yourself and trust your body, that's when you can expand a little bit. That's when you can not be so afraid that any little choice is going to impact your health and make you feel so bad because I get it. You're stuck in years of not feeling well that you're afraid to do anything to make it feel worse or to stay in that state. And I think that's why it's so hard for women who, when they come to me, they're feeling like this for years, that it's hard to make changes because they're like, well, if I make a change, what happens? What will happen if I feel worse? So I need to stay on this plan so that I can feel better. But it's once they get through past that fear is the other side of that is healing. So, but that jump is hard.
It's really hard. But the jump is trusting yourself.
Yes,
And I
exactly.
think
That's where it comes
that's
from.
often why we're sick, is that we don't
Yep.
trust ourselves.
Yeah. That's such a good point.
What is one tip that you would have to become like we talk a lot about, or there's like a lot of noise on social media around nervous system regulation and
Hmm.
embodiment work and these somatic principles. What is one really simple thing? If someone's listening to this and they have no idea what we're talking about, like, what do you mean getting in touch with my body? What is
Yeah.
one thing that you coach clients or suggest that they do to start tapping in?
Question. First of all, I would say get off social media for that. Um, the more that you consume other people's content, and while it's great, obviously, and I do it, and I still think it gives you good ideas. But the more you do that, the less you are in tune with yourself. So sometimes it's lowering the stimulation. So, going on a walk without anything or cooking something without watching something or listening to something at the same time. It's really just being a little more mindful, being more present with yourself and kind of figuring out being with your own self while not with others, and tapping into yourself and kind of what feels good for you and being a little more mindful when you're doing things. So that way, how your body feels in the moment, how you're reacting to certain things, how you're reacting to foods, how you feel when you're eating something or how you feel when you're moving a certain way. And really listening to that and not pushing yourself, not going off an agenda because those what I eat in a days or how I'm working out in a day type videos are great, but then you're going off of someone else's body. You're not listening to, well, I don't really want that yogurt bowl right now that someone else is eating. I want to have a smoothie. I don't know. Or they're doing a Pilates workout for an hour, but I really want to take a walk and not do anything else. Then listen to that. Just because someone else is doing a certain protocol or program that you see online or see even around you and your with your friends doesn't mean that works perfectly for you. In high school, one of my friends was doing a workout plan and I tried following it, did not work for
Is
me.
it like
And
BBG or whatever?
no, I did that, and that actually wasn't bad for me, but she had a trainer and they had a specific workout plan for her, but we had different body types, so it worked really well for her, but for me, it made me way more inflamed, but I thought, "Oh, I'll do it with her because, we're pretty similar." No, but that's a good example of what works for someone around you on social media, your friends, may not work for you, so really cutting out that noise and figuring out what works for your body and your lifestyle, and then you can still consume all of that media, but with a context of this is more for entertainment, this is more for ideas and inspiration, but I don't need to be following this. Because I
Right.
think people see there's so much online, I should be doing this and that. And how do I consume it all and do everything? And it's really taking that within the context of this is good information. I'm going to use this, but make it for me.
Yeah, totally. And I just think that that's also another example of they have the body I want. They have the balanced
Yeah.
hormones. They have the perfect skin. They're not super bloated. Like, therefore,
Yeah.
I should copy and paste this. But
Yeah.
that's still outsourcing your healing to somebody
Yeah.
else's planner program. And like, we never truly will heal unless it's coming from us, unless it's coming from like what our body wants, listening to it.
Hmm.
And it's so funny because I mean, I've talked a lot about like my frigidity around all of this, but I definitely used to be like, "Oh, strength training for women, you have to do it. I have to do it 5 days a week. I
Hmm.
need to do 2 days of cardio. If I go for a
Yeah.
run, it needs to be 5 miles to count." And I was working out way more when I was like felt horrible and my body was uncomfortable. I was so inflamed. And now I literally will wake up and be like, there's just no rules or pressure. It's do I
Hmm.
want it today I did a HIIT class. These past 4 days this week, I did like the most gentle yoga and Pilates. I just quite honestly didn't feel like it.
Yeah.
And that leads you to be more consistent too when there isn't pressure and like you're not exhausting your body. And some days you're going to push yourself and you might walk 15,000 steps and do a HIIT class. And then the next day you might go
Yeah.
for a run. Other days, and for women too, it's like so dependent on your cycle. Other weeks or months or few days, you might take it easier, but that leads also to more consistency. And I think that we see the best physical
Yeah.
results if that is something that you care about. It's like the aesthetic and the tone and the muscle when it's balanced, when you're cross training, when you're listening to your body, and it just also allows you to enjoy movement more and then be more
Exactly.
consistent with it in whatever form feels good to you.
Exactly. I'll have some clients ask me, like, what should I be doing for workout? Give me a plan. And I don't provide workout plans. First of all, that's not my area of expertise, but I'll say, okay, you should be doing this kind of thing, depending on the person. If they're having a cycle, I really do encourage more cyclical workouts,
Yeah.
but also in the context of listening to your body. I can't tell you that, oh, okay, in this week that you're supposed to be doing more HIIT exercises, that you should be doing that every day. If it doesn't feel good for you, I'm not going to force that on you. So it's still using how you feel when you wake up every day. And I don't have a consistent workout routine. It's like you, I one week I might work out every day and then the next week I might do basically nothing and just walk. And that's okay. And yes, I still think strength training is great, especially, for my perimenopausal, postmenopausal clients. I do encourage strength training so that they preserve their bone, their muscle. And especially even when you're younger, that's when you're building your max bone density. I do still think strength training is great, but not with that rigidity of, well, you need to be doing that 3 to 4 times a week. It's really any movement is great, even if that's just walking. And if you don't get 10,000 steps a day, that's also okay. But having that not be such a rigid rule makes such a difference because that's over exercising is when women lose their cycles. And when they start breaking down all the other parts of their body because they're overdoing it. And that impacts their nervous system and then their hormones and then their gut and all of a cascade of symptoms. And it really comes down to they were just pushing themselves too hard. And so once they lessen what they think was helping them, that's when they heal.
Yeah. What does our cycle tell us? Like some I've heard in the functional space, especially that like a woman's cycle is her fifth vital sign.
Yep. I was going to
Tell
say that.
me, yeah, tell me a little bit about that.
It really is. It's something that honestly we should be celebrating and not, people say, oh, I don't have a cycle. Or, when someone's pregnant, they'll say, oh, it's so great because I didn't have a cycle for 9 months. And that's fine, but that's not what we should be celebrating. It really does give us the context of how is your body functioning? How are your hormones? Not just your estrogen, progesterone, all of your hormones. If you're not having a cycle, you're not forming bone as well. You're not doing a lot of things in your body that you should be doing or that should be happening. And so for longevity, it's really important that we have consistent cycles, that you're ovulating, consistently. And the quality of the cycle, the length, all of that matters. And yes, there's variations with women, but we're not taught that. A lot of people have such heavy periods that they don't go to school, they don't go to work. That's not normal. If it impacts your day to day life, that's where women should seek help. But we're not taught that. You're just kind of taught this is normal, suck it up and keep going. Or you don't have one, great. Now you can participate in sports better and you can not skip days of work or school, which you shouldn't be anyways. But all of that isn't normal and it's not talked about. But I think it's becoming more of a conversation. All of women's hormones are becoming more of an open conversation, from that to perimenopause and menopause. I think more people are talking about it because now women are realizing this experience isn't normal, or it should be talked about because it is normal. Actually, women are 51% of the population. We are actually the majority. Women's health is not a niche. It is something that should be talked about, and our cycles are something that we should live by. Men have a 24-hour cycle and women have a roughly 28-day cycle. Every day is different for us, but our society is run off a 24-hour cycle. And so we don't function as well doing the same thing every single day. And now I think people are realizing this. And even for a lot of women who own their own businesses, I know that some try to schedule things more in that 28-day cycle, which
Oh,
I think
yeah.
is really cool. And it's something that people are doing a little more and giving women a little more grace for. And I think that's something that society needs to move towards.
I want to ask you, this is something that came up with like 3 of my very good friends. Ironically, we were all in our luteal phase last week. And it was not good. A lot of
Yeah.
crying, a lot of anxiety, really
Yeah.
low. And for me, I have 28-day cycles, 4 days of bleeding, very minimal pain. I ovulate I'm very, very regular. But the PMS thing is I'm still trying to figure
Yeah.
out. And a lot of my girlfriends too, super regular, but the emotional PMS is really bad.
Yeah.
And I was reflecting on this. It's something that I wanted to ask you of. I think that, obviously I was looking at the changes in your hormone levels during the week, during your luteal phase, the week before your period, and it is pretty
Mhm.
drastic.
Yeah.
Women are on a 28-day cycle roughly, and we're living the same life for 28 days, even though we
Mhm.
feel very differently in our body and our
Mhm.
physiology is very different from week to week, day to day. How much is it a product of women are trying to maintain this consistent level even when their body's going like this? And that
Yeah.
rigidity or that lack of alignment is exacerbating the emotional symptoms. I don't have the energy for this. I feel stuck. I feel panicked, anxious, or depressed. And
Mhm.
what level of it is like, this isn't normal. We need to look into our hormones, or, maybe it's a hormone imbalance. And I'd ask you that question as well for like period pain. And some
Yeah.
people have insomnia and migraines. Like, when is it not normal, but maybe the contrast of we need to be resting, we need a little more TLC, we need to be not
Yeah.
having plans that week, but we're still operating at this level because society expects us to. And then what is, hey, we should probably look into this. Maybe there's an imbalance going on.
Yeah, it's said that if it's really impacting your day-to-day life, like if you can't go to work, you can't go to school, like that, especially with the pain, but just in general, that's when you really want to seek help. If it's something like, okay, I'm a little more emotional, you can still seek help, but that's not what we're talking about for that. But I do think it is a product of we're trying to live the same for 28 days. And we are supposed to be a little more fatigued and potentially a little more emotional during that time. And there's nothing wrong with you if you are that way, but it's hard to live in our society and say, well, I want to lay down today and I want to cry
Yes.
when I have to do something. So it's hard to do that in our society. So then we're going against something else. So it's another more tension that adds and it builds and builds. And then you start feeling worse. There are studies that show that cycle syncing, like living more cyclically really reduces PMS symptoms significantly. So it comes down to sometimes if you give yourself the grace during that time, a lot of those symptoms reduce. But if you're still having significant ones, that's again when you want to seek help. But
It's
we
funny
aren't
that you
meant to
say that
feel the
'cause
same.
mine was last week, and last Friday, I was just like, I couldn't stop crying. I was in such a mood. And I was like, you know what? Like, I am not gonna, like, blow dry my hair like I said I would for this podcast recording. I'm gonna have my favorite tea and chocolate, and after this recording, I'm gonna go for a long woods walk, and I felt fine. Like, it miraculously went
Amazing.
away, and I was like, and that's why I wanted to ask you that question, because I was like,
Yeah.
I wonder if so much of the exacerbation is that we feel so pressured, and this goes back to that
Yep.
perfectionist, that harder is
Mhm.
better, of we feel really emotional, or we feel really lazy, or we feel really lethargic, or we
Yep.
kind of are in a mood, but we feel so guilty or so ashamed, or no, we have
Yeah.
to keep pushing. We shouldn't feel like this. And it's like that rigidity almost makes you like, but if we just like let ourselves.
Exactly. I will say for me, definitely when I stopped working out as much during my luteal phase, a lot of my symptoms improved because I used to work out the same day every day of the year. And then once I stopped doing that, so much improved. A couple weeks ago during mine, I my friend invited me to a workout class. I thought, well, I probably shouldn't, but it also is something beneficial because I'm going to hang out with my friend. So I just didn't push myself as hard as I could have, and I was fine. So it can go either way. It's not like, well, the rigidity of the rules, oh, I can't work out now during this time. No, it's maybe be a little more mindful about not overdoing it, but you can still do things with others. You can still enjoy things. You could still go to workout class. Just it's not going to be the same every day. If you did the same class, maybe for 2 weeks, you're pushing yourself more. And then the other 2 weeks, you're not. Our HRV doesn't stay the same all month. Our resting heart rate doesn't stay the same all month. During your luteal phase, your HRV drops and your resting heart rate rises. They actually say wearables don't do a really good job measuring women's HRV because they're under a male algorithm. And so it'll tell you, oh, your HRV is this, you shouldn't exercise today. But maybe you can, it's just not at the same intensity. But your watch doesn't realize that you're in a specific part of your cycle, or your ring or whatever you're using is not doing as good of a job noting the differences that we're supposed to change. We're not supposed to be the same.
I have a question for you on that. During your
Mhm,
luteal phase, your HRV can drop like 10, 20
mhm,
points. Your resting heart rate
mhm.
can go up like 5, 10. Does
Yeah,
that mean that your body is under more stress? Or is it just like a reflection of the hormone fluctuations?
it's a little bit of both. I think that it's your body is under a little more stress due to the changes in the hormones, but that is also just the way that physiologically it happens. You can That's the thing. Your HRV could drop significantly. Your watch says your readiness is 0. And you actually have some capacity to do some gentle workout. That's where you have to listen to your body and not the external factor.
Mm,
Not that, I mean, the wearable is great to have some data and you can see the trends, but I want people to go back multiple cycles and watch the trends. It'll probably be a very similar one where in your follicular phase it rises back up, but in your luteal phase it drops. That doesn't mean you can't work out during your luteal phase. It's just maybe alter the types of things you're doing.
yeah,
Give yourself a little more grace. But if your watch says you have no readiness, but you feel fine in your luteal phase to do something, you should.
right, right. Really interesting. What are your top, and these are going to be general, so not like an individual protocol, but just in general, what do you find to be the few principles, tips, suggestions that help women balance their hormones or support hormone health?
I think it's a lot of what we've been saying. It's really living, well, for younger women at least, living more cyclically, listening to their body and understanding that you change every week and that honoring that is really important. And by not fighting that and trying to be the same and rigid every day, you will actually feel a lot better. And so that could look like altering a little bit of your diet here and there, altering your self care practices, maybe adding in more self care during certain times of the month, lessening some of your workouts or the intensity of them, that really makes a big difference. Um, and then balancing your blood sugar with your diet is another big one. Minimizing those blood sugar spikes minimizes those cortisol spikes, mood, energy, all of that will feel so much better.
What are a few tips to balance your blood sugar?
I like to say having more rounded meals, so a good amount of protein, carbs, and fats in a meal, and having those consistently rather than just having naked carbs, like not having fruit by its I mean, fruit by itself can be okay on occasion, but having pieces of bread or rice cakes by themselves, not pairing those with fat and protein, that will spike your blood sugar more. But I like to pair those with something else. So if you're having a piece of fruit, having some nut butter with it or having some yogurt or something like that is really helpful.
Yeah, that is important. You can definitely feel a difference too because your energy doesn't tank. Like, you don't get a
Exactly.
3 p.m. slump if you balance your blood sugar.
Yes, if your blood sugar spikes and crashes, think about that. Your cortisol might do that, your mood will do that, your energy will do that. So you'll feel great in the short term, but then at 3 p.m. you're spike or you're crashing back down.
Yeah. What are a few of your grocery staples? Like things that you always have in the house for hormones, for women's health?
I always have kale because I like to make a kale salad. I'll do that with a lot of herbs like parsley, dill, and mint, some lemon and olive oil, and then I put hemp seeds in it. So it's
Oh, yeah.
kind of like it looks like a tabbouleh, but it's not. But it has that feel to it because the hemp seeds are kind of like the I think it's bulgur, isn't there? But there's no gluten or anything like that. It's just the kale and the hemp seeds and all of
Yeah.
the herbs. So I like all of those. And then for snacks, I always have some Simple Mills, whether that's crackers or like a baking mix. I always have those.
Have you had the Simple Mills brownies? I think I brought these up on the
Yeah,
4 podcast episodes.
I love the
They're
Simple Mills brownies.
insane.
They're
They're
so
like
good. Didn't you make them recently? I feel
yeah,
like I
oh,
saw
I've
it.
made them, like,
Yeah.
every week for the past 3 weeks. They're like fudge. Do you remember the Ghirardelli ones from childhood?
Mhm.
They're
Yeah, they're really good.
exactly like those. I put peanut butter in them too. Oh my god, they're so
I
good.
love them.
That's the
I'm
thing
gonna
too.
go make some now.
Yeah, I know. They're like the best weekend treat. But that is the thing too, is like I do was coaching, like a lot lifestyle alignment coaching where I help people clean out their pantries or clean out their cosmetic cabinet
Mhm.
or just like restructure their routine to be in alignment with how they want to feel. And so many people are like, I have such a sweet tooth, I can't give up cookies, or no, I love baking, I can't give this up. And I'm like, there is literally a substitute for everything. And if you look at the Simple Mills ingredients, it's all whole foods. There's
Oh,
nothing
yeah.
in there that is processed. It's amazing.
I love them. Yeah, that I would say most of my snacks are all like that. Back to when we were talking about kind of like where do you prioritize? In my house, I always buy that kind of thing. The snacks that have the better ingredients. You will not find a snack from a traditional grocery store in my house. It's usually everything is from Whole Foods or Trader Joe's with the cleaner ingredients, that kind of thing. But when I go out, okay, maybe I'll have something that I wouldn't make in my own house or that I wouldn't keep in my house.
Right. The thing too is like you talk about consistency. It's just like what you do most often is what builds, you know, literally is the structure of your cells,
Mhm.
regulates your systems, like what you eat, how, whatever you do on a consistent basis really builds your state of health. But when you
Exactly.
have a strong state of health, you also have more resilience. So, like, I obviously understand if you're gluten free or dairy free from like a food
Mhm.
sensitivity or an allergy purpose. For me personally, I'm not anything free. I used to be quite literally everything free, and now I am nothing free. But I don't crave that stuff. Like, my house is full of
Yeah.
things I like to feel good, and I lead with feeling good, not fear and control. So for the most part, 80%, 90%, I don't even know. Some weeks it's 100%, some weeks it's 70% of the time. I'm
Exactly.
eating very clean whole foods based. And then I noticed that if I go out to dinner, if I want the salmon, I'll have the salmon. If I don't feel like something heavy, I'll modify it. If my body feels like super resilient and it's craving a bowl of pasta, I will have that and I will have no issues. Like, I feel great the next day.
Yes.
And it's because you have a higher level of resilience internally from what you do most of the time. And I always think it's
Exactly.
what you do most of the time is not following a playbook perfectly. It is literally being intuitive. Like,
100%.
yeah, but
And
it's
it also is how are you coming into that meal? With what emotions? Are you afraid of that pasta? Then you're not going to do as well with it. But if you're coming to it with some excitement and joy and you want to eat it and you know it'll make you feel happy and feel good, then that's why you feel so good. That's why I think on vacations too, of course, quality is also sometimes better in certain countries, but you're happier when you're eating it. You are in a calmer nervous system state. You're in a state of joy and alignment. And that's where a lot of that digestion is better and you just feel better. Also, within the context of you have those 80 other percent of the time that you're doing those right things with your diet. So that foundation's also there and you have more resilience from within.
totally. And I think when you get to that place too, like for me, it was like so black and white that if it was like, and if I had a bowl of pasta, I'd like also have dessert because I was like, I have to get it in
Hmm.
one day.
Yeah.
And when you just like learn to trust, and that's like a whole nother issue. But like
Yeah.
once you just like learn to trust your body and like you can order the pasta and eat it until you're full. And then if you want dessert, have it. If you don't have it. If you want a piece of fruit when you get home, have that. Like if you
Hmm.
just learn the rhythm of your body, there doesn't become this like excess and these swings. And also when people are like, I do really well and I lose the weight and then I gain it back, it's because of that. But if you
Yep.
can just live in, like, kind of the average or,
Yes.
I don't know, then there
It's
aren't
not
these
black and white.
it's not black and white,
Yeah.
exactly, and it can feel
Yeah.
so counterintuitive to a mind that is, like, an analytical and perfectionist mind, but true health is, like, just being embodied and, like, kinda living in the middle.
Exactly.
Crazy as that sounds.
Yes.
Amazing. I always ask actually, let's do a quick rapid fire because 'cause you're just, like, full of all
Okay.
the good tips. Your top sleep tips.
Okay, so it would be circadian rhythm and light regulation. So making sure that your room environment is dark, cold, and quiet or with white noise. And then quiet meaning like you're not getting straight noise. So if you are getting some white noise, and then getting in morning sunlight. So really regulating the light and then dimming your lights in the evening so that you're not getting too much blue light as well.
Love that. Top nervous system regulation tips.
This one is going to be for a general. There's always so many mindfulness and meditation techniques, that kind of stuff that are great. But really being mindful throughout the rest of your day, like I mentioned before, where, how are you eating? Are you cooking your meal and then eating it at the table with others, maybe versus at your desk, at your computer, watching TV or on your phone, kind of not paying attention. So being mindful throughout your day can really calm your nervous system on a day to day basis versus in this moment, I feel really stressed. Here's some technique to fix it. It's kind of how do you bring all that high stress down throughout your day?
Good one. We did top hormone healing tips, top glowy skin tips.
This one I like is kind of general lymphatic work. So focusing on your lymphatic system, whether that's dry brushing or gua sha or anything else like that, rebounding, jumping on a mini trampoline or just jumping, treading water. All of these things are really good for your lymphatic system and that can help keep your skin a little more clear. So I'm not like a
Dude, I had
skincare person,
never heard
but
that was the best tip I've ever heard, jumping on a mini trampoline for your skin. That
I
is
have one right
amazing.
there. I'm staring at mine.
Stop. Well, it's so funny you say that because 'cause I'm obsessed with trampolines. Like, Sky
Oh,
Zone's one of my favorite places at the North Shore Mall. I still go.
yeah,
I'm
yeah.
20 years old. I'm gonna order one of those. Do you do it for, like, exercise or lymphatic drainage?
Both. So it is really good for exercise, but for lymphatic drainage, it does really help because your lymphatic system doesn't have a pump like your cardiovascular system does. So you need to manually move it. And most of the time, that's just physically moving your body. Jumping on a mini trampoline does really help. That's why I said treading water also really helps. You can do manual massage and it's really light. You can get a lymphatic massage. You can do light dry brushing, but the trampoline's more fun and it's a 2 for 1 because you are exercising at
Sweet.
the same time.
Send me the link. I'm gonna order this as soon as we get off. I love that.
It's fun.
Yeah, I love that. Okay, one thing that you do every day to feel your best.
So this one I think is going to be a little weird, but I am not actually as I'm a creature of habit, but I don't have a routine. So
Mhm.
I don't wake up and say, "All right, I'm going to do this and then this and then this." Other than now I started incorporating dry brushing actually and some more lymphatic work pretty much day to day and I do think that helps a lot. But this one is going to kind of encompass my you don't have to be perfect idea. And I have Richardson's ice cream almost every single night. And I think that it truly does make me feel better because it's a ritual. I only really ever eat it when I'm with my husband, so it's something that we do together. If he's not home, I'm not going to have an ice cream by myself, but we'll do it. We'll sit together, we'll talk, and it's something I look forward to, and it makes me really happy. So I think that that has actually made a big difference in terms of my day to day joy and enjoyment of things. And I feel like I'm not restricting foods. I can eat whatever I want. I can have it if I want to. And yeah, some days I don't, but I do it a lot of times.
I love
And then I don't actually snack all night long because I was satisfied with my little bowl and then I move on. So that truly does make me feel my best. But there's
I
also so many other things I do. But
It's a really good one. That was a really good one. I love that. What
thank you.
flavor?
Mocha chip
Oh,
and always some other flavor, but always mocha chip.
Richardson's is it's so weird. I don't even like hot dogs, but they have the best hot dog I've
So
ever
random.
I know. It's so random. I love it. Maybe our next hangout will be at Richardson's.
There we go. That'll be great.
Amazing. Well, this has been so much fun and packed with so many good tips and actionable takeaways. Where can everyone find you?
So I'm on Instagram at Anasoma Integrative Wellness. I have a website, anasomawellness.com. That's my business name. I'm on there and I'm on LinkedIn personally. So just Dr. Alexia Soteropoulos or
Awesome.
Alexia Soteropoulos MD actually is probably what my LinkedIn says.
Perfect. Amazing. And we'll link that all in the show notes so people know where to find you.
Perfect.
Thank you for coming on. This has been a blast,
Thank
and
you.
I'll see you at Richardson soon.
Sounds good. Thank you for having me.
Thanks for listening to Let's Feel Good. If today's episode helped you feel more clear, empowered, or inspired to take action on your health, I'd love if you'd subscribe, leave a review, or share it with a friend who's on their wellness journey too. You can find today's show notes, links, and extra resources over on Substack at letsfeelgood.substack.com, and follow along on Instagram at Let's Feel Good Club for more real-life wellness tips in between episodes. Because how you live determines how you feel, and we all deserve to feel amazing. See you next time.